Look at the latest. For today's COVID-19 update, we have in-house, in your house, Dr. Brian Harrington. Doctor, how are you doing this morning?
I'm doing well this morning. Good morning, Eric. Good to see you.
Good to see you as well. We've had some increase in our caseload this week
Yes,
here in
yeah.
Routt County. Can you speak to what that means for us?
Yes, we're not, in public health, we're not entirely surprised. We did see several cases this last week, both local, 8 cases of local residents, plus 16 related with out-of-county residents. Now, on one hand, you could say that 16 is concerning. Now, not all those people had much of at all significant interaction in our community. We had an outbreak at a hunting outfitters operation in our county. Those were out-of-state people who arrived. It appears that one person arrived with symptoms and then infected other staff members and maybe some other clients. Those people, though, were mostly at that hunting operation, had minimal interaction in our community. We had, of course, some cases related to a wedding. And so a lot of these things, I think, are related temporally, certainly to the Labor Day weekend. And then we kind of see this trickle out a couple weeks later, people getting symptoms and so forth. But of certainly serious concern, we jumped up to several local cases, 8 cases over the past week. And of those cases that we had, they represented a little more spread in the ages. Now, granted, the numbers are small. We can see ups and downs from week to week. So potentially it's not a statistically significant change, but at least when you eyeball it, you go, well, that's different. Many of our cases have been driven by people in their late teens, 20s, and 30s. That's been the bulk of our positive cases. This past week, we had several people in their 40s and 50s. If that trend were to continue, it probably would indicate greater community spread. Also, several of these cases, in fact, just about all of them, of the local residents did not have symptoms. I'm sorry, they did have symptoms. And typically throughout this through the year, we've had many people that did not have symptoms, either because they had surveillance testing or because they're close contacts, and we picked it up that way. In the last week, all of these people did have symptoms. And so you kind of view that as the tip of the iceberg, that there's also a percentage of people out there who don't have symptoms that do have the disease. Now this doesn't have to be a panic point. We've had times throughout this pandemic in July, for example, when we had more cases per week than we had last week. We've been here, and we've got to curve back down to zero. So this, doesn't mean that we're in some necessarily different state, but it will be interesting to see what the trend is for the next few weeks going forward.
And how long are these patients that are starting to see symptoms? If they start to see symptoms, they wait a couple days or 2 days maybe to go get tested. But how long can they have it before they start showing symptoms for potential spread of asymptomatic spread?
We think on average, or that the bulk of people demonstrate symptoms 5 to 7 days after exposure. There is evidence to suggest that people may actually have their highest viral load a couple days before they even get symptoms. And we see this with other viral illnesses too, that people are most at risk for spreading it before they even know they have it.
Wow. So an increase of cases in the past week, and
Yep.
now officially a middle school student. Looking ahead in the future, I guess you can't really you don't have a crystal ball, but is it now that we have 8 cases, we should expect to see 10 next week, or is it pretty isolated?
Yeah, I can't, I can't predict on that. On one
Yeah.
hand, I have fear that this is the beginning of an upward slope. On the other hand, we can look back through our personal experience here in Routt County, and we've had higher numbers in the past, and then they came back down. So we have the ability to keep it in check. And I've gained confidence over the summer that the things that people in our community are doing, mask wearing, social distancing, the fact that we are geographically a fairly dispersed community, those things appear, I would surmise, to have played into kind of a check or a cap on disease when it starts to grow in our community. This does remind us, though, that we have to remain vigilant. We have to persevere, word I chose to use this week, because we've still got quite a ways to go with this. And I think we're all feeling fatigue and kind of worn out with it. I am. I'm tired of wearing a mask. All these things. Those are natural feelings for all of us. However, we can't let up. The disease is still there. We still have the risks involved with it. And we're probably stuck in this mode until we start to see a vaccine, which I would not expect to see until sometime earlier next year.
You heard it, guys. Stay home if you're sick. Wash your hands. Wear your face mask over your nose, even, and
Yes.
keep doing what you're doing. Keep doing what you're doing, guys.
Yep.
Well, doctor, thank you so much for joining me this morning. I really appreciate you being on air with me. I gain a lot from these updates, so thank you so much.
Great talking with you, Eric. Have a good weekend.
Guys, stay home if you're sick. Wash your hands. Wear your face mask. Stay vigilant. You heard it from the doctor himself.